This is one of my cases where we placed the JADA system in the operating room. So this patient was a 41-year-old G4P0030 who was admitted at 36 weeks gestation for induction of labor. This was an IVF pregnancy. She had a BMI of 48. She had chronic hypertension with superimposed preeclampsia with severe features, which was her indication for induction. She had a significant asthma history with history of recent hospitalization, as well as the use of a daily inhaler. So this just checked all of our tick boxes for people at risk for hemorrhage and things that we can't use our normal stuff for. So she got admitted for her induction, and then she got her epidural. Things started to progress. And then they stopped, and she underwent a C-section after failed induction after about 3 days or so. So baby was born, relatively small, 2,800 grams. We started our usual postpartum Pitocin, and rather quickly, we started to note that there was pretty significant bleeding. And at that point, a couple minutes had gone by. We administered misoprostol because that was the option that was available given her comorbid conditions. That didn't really do much. And so at that point, we did a uterine artery ligation bilaterally in the O'Leary technique. That slowed the bleeding but did not stop it. And so at that point, she'd lost about 1,500 of blood. She was about 3 centimeters dilated when we started. And so we felt that the JADA was a good option. So we were able to place that relatively quickly at a blood loss of around 1,500. The JADA was placed. It was confirmed in situ. About a minute or two later, the bleeding improved significantly and was controlled. She got about 2 units of blood in this whole scenario, given the rapidness of bleeding that occurred. This was not because there was ongoing bleeding after the JADA, but just the amount of blood loss in the short period of time. It was felt that it was warranted to give her some blood. Of note, and then it was in for an hour, and then deflated and no further bleeding, and the JADA was then removed. This was an interesting case because it was one of the first times I had placed a JADA in the OR with one of the residents, and she exclaimed, "Oh, wow," as the suction initiated. And you can watch the uterus just shrink down before her eyes, and that was really exciting to see. So for this case, after the bleeding was controlled and the JADA came out, we didn't need to give her anything additional for control of her bleeding. She did have her antihypertensive changed and up titrated before discharge, but otherwise she had an uncomplicated postpartum course, and she was discharged home on postoperative day 4 and then did well afterwards. It was one of those silly putty uteruses where you can lift it up out of the abdomen, and it very rapidly became firm and hemostatic, which was incredible.